Hi everyone, welcome to June's video. We will be discussing the 1200 calorie diet for pre-op patients, okay? So the pre-op diet is usually 2 weeks unless your surgeon tells you otherwise. So today we have here one of our doctors, Dr. Roshak. Say hello.
Welcome.
Good morning or good afternoon, whatever it might be for you.
So we're just gonna go ahead and discuss what the pre-op diet is. So tell us, what is the purpose of this pre-op diet?
So whenever we do a weight loss surgery, we're going to be dealing with the anatomy of the abdomen, and the biggest organ that we kind of have to worry about is the liver. Okay, so the liver actually sits right on top of the stomach where we're going to be doing the surgery. And obesity can cause a condition called fatty liver. And so when the liver is bigger than normal due to obesity, it's harder to do the surgery. It's harder to lift the liver out of the way. So we have everybody do a diet that's designed to basically shrink the liver and make it smaller so that we can actually see the stomach and do the surgery better.
So why is it mandatory?
Well, it's mandatory because if we want to do the surgery and the liver's too big, then there are actually some circumstances where we try to do whatever surgery we've selected, and because the liver's too big, we can't even do the surgery.
Okay.
So over the last couple of decades, we've kind of landed on this particular diet because it's the most effective to allow the surgeons to perform the surgery in the best possible, circumstances.
Okay. So that would be why it's so important to follow that diet.
Yeah.
Well, what I tell my
Patient safety.
what I tell my patients is, you don't want your surgeon to be struggling
No.
during an operation just to try to get the liver out of the way. Or if we're focused on the liver and we're not focused on the stomach, then the patient actually might not get the most optimal circumstances for a surgery. So yeah, it is important to do that diet.
Okay.
So with the pre-op diet, is there maybe any side effects that come along with it?
It depends on the patient. If you have a pre-existing condition, maybe diabetes or blood pressure, and you start this diet, the first thing is that when you're on a low carb diet, the body will end up shedding some of the water that's in the body. So you burn up, what happens is you burn up your stored sugars. That's why when you're not eating carbs, your body will use the stored up carbs. So once you burn up the carbs, that's what actually shrinks your liver. Well, water is actually attached to the carbs in your liver, the glycogen. So once the water goes away, some patients can end up feeling a little dehydrated, or they can feel lightheaded or dizzy because the water it's not staying in the vessels and it's not staying in the body. So, we recommend staying very hydrated during this process. So that your blood pressure doesn't drop too low or you end up lightheaded or dizzy. Same with diabetic. When your body is used to eating a certain amount of carbohydrate, and then we change it to a very low number, your insulin requirements may change. So if you're taking insulin or if you're taking medications for diabetes, those will probably need to be adjusted before surgery and even after surgery as you start to lose even more weight. So those are two conditions that we really recommend patients monitor their blood pressure, monitor their blood sugar, because that's something that may need adjustments with the medications before and after surgery.
Okay.
So what is the pre-op diet? So it's usually 2 protein shakes and...
Protein shakes, protein bars, and a meal. So, it's 1,200 calories and it's low carb. And we have it in our packet that we provide every patient. Has kind of specifics and recommendations, but basically 4 or 5 units of the protein shakes or protein bars. So a unit would be 1 bar or 1 shake, and you'd space those out throughout the day. And then you're also able to eat kind of a quote normal meal at the end of the day. It's not normal, it's small. So it's maybe 5 ounces of a lean meat, and we have a list of, in our packet here of all the different things you can choose from. and then also 2 cups of non-starchy vegetables. So like good vegetables, usually green vegetables like salad, broccoli, yeah, all those.
Asparagus.
Yeah, potatoes ain't
Brussels
on the
sprouts.
list. Yeah,
Oh, no,
no
potatoes,
potatoes.
no.
I mean,
No.
if it's starchy or high in carb, that's not going to help the diet at all. So it's kind of those good for you vegetables, which President Bush didn't want to eat when he was in office back in the day, if y'all remember that. But yeah, broccoli is one of the best ones.
And then so lean meat like tilapia.
Sure.
Turkey.
Yeah, absolutely.
Great.
Sounds good. So we have some examples here of proteins for you guys. So some of the most recommended ones by our clinic. So Fairlife, Muscle Milk,
And Premier.
We also recommend Orgain, but I was not able to find Orgain, you guys.
Yeah, Orgain and this muscle milk here are both plant-based, and so if you have a lactose intolerance or something like that, you'd want to do this one or the Orgain, and then the Fairlife and Premier. Really, if any product which is low in carbs and high in protein, 20 to 30 grams of protein would be recommended. And we have some patients that don't like the shakes, which is fine. You can do the powder, and you can mix the powder with whatever liquid, whatever low carb liquid you'd be comfortable with.
So usually the store has really big jars of powders, or they'll have something like individual little packages that are on the go. So this brand here is Celebrate. This one's got 27 grams of protein, and it's 170 calories, and there's so many different flavors. Vanilla, chocolate, and they even have a chicken soup one, so in case you want to do something hot. And I know Bariatric Advantage also has a protein meal replacement as well. And which one do you have there?
I have vanilla and I have chocolate and orange cream.
Good products, all of them. Again, every patient's a little different, so you want to look on the label. Make sure it's low carb, low net carb is what we look for actually. And then also, if it tastes good, that's a great thing too, because you might get tired of some of these products as you do them for a couple or 2 or 3 weeks before surgery, and then you're gonna have to do it for another 3 weeks after surgery. So what I tell my patients is pick the one you like, and it's even better when you pick kind of a variety of different ones, because you might kind of get tired of these after a while. But they're really important, before and after surgery to maintain for different reasons. But before surgery, we really like to have the low carb for the liver, like I said. After surgery, you're on liquids only for 3 weeks, and that's really important so that you heal properly and that you don't bust a staple or something like that.
Yeah, so get very comfortable with protein drinks and protein powder. And your protein powders, that can always go in soy milk, almond milk, water, really any base that you like, as long as it's a comfortable consistency for you and you're able to keep with your protein goal. So just to briefly discuss protein bars. So when choosing a protein bar, you want to go ahead and make sure it's high in protein. Okay, so something like 20 grams of protein or more, and that it's low in net carbs. So these are all pretty good examples of bars that you can buy at your local Walmarts, pharmacies, that are pretty good in calories, carbs, and protein.
A couple bars that we don't recommend you taking just because they have a lot of carbs in them.
A lot of fillers and sugar.
Yes.
Yeah, just read the label if you're not sure, because there's so many different products out there. I was at Costco a few days ago, and they had the Kirkland bar is actually really good. The Meta bar I saw there. So there's a bunch of good ones, and then there's also some that are basically just candy bars, and we don't recommend those just because that's not going to help your diet at all, and that's not going to help your liver at all.
So Costco and Sam's are actually the best stores to get your protein shakes and your protein bars in bulk.
100%. Okay. Yep. Good cost, good price, lots of it.
So just a brief reminder that we do have a Veritastic code now for the app. It is 93054, where you guys can go ahead and track your calories, your protein, your water, for the day, of course, and the app is completely free.
Berry-tastic.
Very tastic.
Yes, and they got some great recipes on there too.
You can make it English or Spanish. They have recipes for all stages. They even have a section for exercise, okay? And if you use our code, then you're able to see information that we have posted on the app. So it's personalized for the Nicholson Clinic page. There is certain sauces or dressings that we would like for you guys to avoid during the pre-op diet. We'll just kind of go over those briefly and as to why we can't use them.
Yeah, I mean, basically it's just high sugar stuff. I mean, ketchup is full of sugar. It's delicious, but it's full of sugar. So look on our little packet and try to do lighter, low carb stuff if you're gonna add that to salad or whatever you choose. But just remember, kind of high sugar is bad again because we're trying to lower the carbohydrates so that your liver will shrink.
So no teriyaki sauce, you guys. So the pages we're talking about here on the bariatric packet, okay, is page 31 through 35. That is the 1200 calorie pre-op diet, okay? So you're more than welcome to follow along, kind of read through that. Most of this information will be handed to you during your consult. And once again, whenever you schedule your surgery, your patient care advocate would be sending this to you by email or by the patient's portal.
Yeah. The last page of this pre-op diet is 35, and it talks about liquids. So if you want to flavor water, because water gets boring too, we've got a whole list of Crystal Light, sugar-free Kool-Aid, etc., decaf coffee. Caffeine's actually bad before and after surgery because of how it makes the blood vessels constrict, and it could affect healing. So we recommend no caffeine for all patients before, just so we can get it out of your system, but for a good 6 weeks after as well to help with the healing process. And then just a quick reminder, on the day before surgery, liquids only. So not even a small meal, not even protein bars. We want to really have you on liquids only. And the reason for that is if there's any food remaining in your stomach on the morning of surgery or the afternoon of surgery, and we're doing some sort of procedure where we have to staple, if there's still food in your stomach, that's not going to work very well. So we try to give it a whole 24 hours to make sure that there's no food left in your stomach to increase the safety of the procedure.
Liquids only, and after 10 p.m., no more food. That's the cutoff time for everybody, regardless of your surgery time. 10 p.m., nothing else afterwards, and nothing in the morning of when you first wake up. If there is some sort of prescription you need to take and that we have went ahead and talked to you about it, then you can take it with the smallest sip of water.
Correct.
And that's about it.
You can take certain medications with a small sip of water that morning. There's certain medications that we actually prescribe. There's an anti-nausea medicine that we prescribe to help before surgery. That's totally appropriate to take with a small sip of water. And there are certain blood pressure medicines that we recommend that you take on the morning of. So we'll make sure that you're aware of what that is. If you have a question about a medication, you're not sure if you should take it or not, or if it's too big or too small, please ask us ahead of time. Please, 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 because if you do it the morning of, or if you wait, it might be too late. So try to do all this stuff ahead of time, asking about medications, talking with your regular doctor, whoever prescribes the medications, because they're really the ones that are going to make the medication dose adjustments for surgery. So being in close contact with your primary doctor or whoever prescribes the medications is really important. Another thing about
scheduling the follow-up, right?
Yeah, and another thing I tell patients is some of these pills that people take are very big, and so we recommend that you cut or crush those. But there are certain medications that you're not allowed to cut or crush because they're extended release. So in those cases, I have the patient call their pharmacy where they pick up their medication and talk with the pharmacist and say, hey, I'm having surgery. I need to cut or crush the big pills. Is it okay for me to do this? Because there's so many different medications out there that I don't know all the different ones. And so I always defer to either the family doctor or the internist who prescribes the medicine, or the pharmacist, because they're the experts on those particular medications.
Okay, well, thank you, Dr. Roshek, for all the helpful information. And if you have any questions about your pre-op diet, don't forget to call your patient advocate. We are here to help you with any questions you may have, and even regarding your medications as well.
Yeah, please let us know if you have questions ahead of time. It's always better to plan ahead. Be in communication with your regular doctor. Be in communication with us. We're always happy to answer questions. We have such great staff here at Nicholson Clinic to answer all of your questions, either by phone or email. So please use those resources to your advantage so that we can optimize your surgery and make sure that you have the best possible chance of a great outcome.
All right, so we'll see you next month. Have a good day, everybody.
Next time.